And this is catastrophic for our country. This is an individual tragedy as well. Autism destroys families. More importantly, it destroys our greatest resource, which are our children. These are children who should not be suffering like this.
That was Health Secretary Robert Kennedy Jr. in his presser today talking about the growing concern over autism rates in children and the significant increase in the number of children receiving the autism diagnosis. Joining us now for reaction, the Wellness Company Chief Scientific Officer, Dr. Peter McCullough. Welcome to the program. Want to get your take on what you think about RFK Jr.'s plan to find the cause of autism by September. Is that possible?
I can tell you as a medical doctor and an epidemiologist, autism and its spectrum as a neuropsychiatric disorder is complex, and it doesn't have an exclusive single cause. But it is amenable to investigation of risk factors, and that should be done.
And can we talk about RFK Jr.'s plan to make America healthy again generally? It's fully in action as ADHD diagnoses are also on the rise. The CDC reported that 11.4% of all children in the U.S. have ADHD, pardon me. That's 1 in 9. Why are these numbers going up? Part of me wonders if the diagnosis is actually accurate, doctor.
Well, we're talking about attention deficit hyperactivity disorder, ADHD, and rates are going up all over the world. So it's not just the United States. The same is true with autism. I can tell you that there is increased recognition of both disorders, but there almost certainly is an overprescription of the two major drug categories for ADHD, which are Ritalin and Adderall. And that's because of use in older children who are using it for academic performance. So a strict 6-point definition of ADHD under age 12, that's really the real thing. But it's being used now in teenagers and in college students who really probably don't meet the definition.
Yeah, just a quick 10-second answer. RFK Jr. has been criticized for sort of, being controversial, for being sort of out there. Yet many Americans say he's asking the questions they've been longing for answers to. Your thoughts on how he's handling the position?
No, I agree. He's responding to what the public wants to know, and he's pushing for data transparency and investigation. I'd like to see it happen.
Yeah. Dr. Peter McCullough, thank you so much, sir.